Okay. Master, whenever you're ready. Okay. Good morning, ladies and gentlemen. Good morning to everyone here in room 12 in the United Nations building in New York, and to all those online. Welcome to this event, which is enhancing community engagement and monitoring CRPD implementation through artificial intelligent text mining, economic data, and accessible mapping. A very timely discussion, may I say, at the present. So I'll make some brief comments, and we have a stellar panel here of experts on many of these fields, which we hope can illustrate us more on this very important topic. The data sources are extremely important in any of the phases of planning public policy. Not only that, but undoubtedly during these 20 plus years, the UN CRPD convention was approved in 2006. Let me just state as a fact that I was president of the group that negotiated the CRPD from 2002 to 2005, and had the opportunity of participating very intensively in the negotiations. One of the issues fundamentally was that we needed to be able to fundamental our arguments not only to the financial community, which asked for data, but also to the governments as public policy. And the CRPD became what we wanted it to be, which is an instrument of public policy. If governments sign and ratify a convention, they are obligated by the mandates of that convention, and therefore their public policy must be aligned to the mandates of the convention. And as I see it, we have progressed very importantly. There are some that, when we began the negotiation, thought that the convention was the objective. I am amongst those who think that the convention was the beginning of a process that has been extraordinarily important, because it's one of the most successful conventions on human rights in the United Nations fora. It covers 1.3 billion persons with disabilities, and it also has a impact group, what I call a direct impact group of 2 persons per each person with a disability. So we're talking about a cohort of 3.9 billion and growing. You're either born with a disability, you acquire a disability by accident, by sickness, and by war, like we see on our screens every day. But certainly as you age, as I am, and you're over 65, you have an 85% possibility of having a health deficiency or a disability. This brings us to why we need to enhance the community's engagement in the knowledge of the subject matter, and in procuring that the CRPD monitoring committee have available all the data points that we need for an argumentation with the state that are involved in the monitoring process. At this point, 191. It's almost a universal convention of the 193 countries of the United Nations. So it is a real threshold. What we are looking for in this conversation is to see what policy data, the crowdsourced mapping data, the artificial intelligence, which is driving us all very keenly nuts, because we have a lot of expectations, a lot of fears, a lot of lack of knowledge of what this entitles, not only to this subject matter, but to any other. And that analysis is something that we must learn. In my experience, you have to be able to train civil society, in this case, civil society that deals with disability, as we train other civil societies in the use of these mechanisms as the basis of their argumentation to states, to civil society, or the financial institutions, which in many cases are the multilaterals that finance many of the programs. There are one of the biggest complications, and this comes from an analysis by people like me who are lawyers, and it is the privacy issue. We have privacy issues with artificial intelligence that are always very keen on the maps of these things. And we are seeing with preoccupation the use of national security as an argument in all issues, not only in trade, but that will affect some of these issues politically. Having said that, I would like to open the floor and let my learned professor, Professor Derek Kogan, who I have a long relationship with. Derek and I come from a battle of many years. He is a stellar representative of the academia of American University in this subject matter. Let me confess that we had a program in Asia that was extraordinary and now belongs to more than 30 universities in Asia, which give master's degrees to persons with disabilities as real actors of the principle of nothing about us without us. Having said that, thank you very much for the invitation, Professor. It's been an honor, and thank you all for being here. I'll leave you in the learned hands of Professor Derek.
Thank you very much, Ambassador Gallegos. We really appreciate everyone coming this morning here with us in person. We know it was challenging getting through the past situation this morning, and that will affect some of our audience members as well. We'd now like to turn to Dr. Maria Freitas Martino to give us an opening keynote address. We're waiting on our interpreter to come into the room, and so we'll make a quick slight change to our agenda. I'm so excited that Dr. Martino is able to talk about the work that she and other colleagues are doing in the Department of Economic and Social Affairs at DESA. So without further ado, Dr. Martino.
Thank you, Derek. Your Excellency, Ambassador Gallegos, National Secretary and Manila, colleagues, good morning to all. Let me first of all thank the organizers for inviting DESA for this event, and also extend my warm welcome to all of you here today. UNDESA promotes the achievement of the Sustainable Development Goals for all, including persons with disabilities, and in line with the Convention on the Rights of Disabilities. The convention was adopted in 2006 and is a landmark in the promotion of the rights of persons with disabilities. The Sustainable Development Goals were adopted in 2015 with the call of leaving no one behind. To respond to a request of the UN General Assembly to produce a flagship report using data and practices to reflect on progress made towards the implementation of the convention, as well as the realization of the Sustainable Development Goals for persons with disabilities, UNDESA has produced two flagship reports, one in 2018 and another one recently in 2024. These reports found that the situation of persons with disabilities has improved considerably since the adoption of the convention 19 years ago. Remarkable progress has been made in the adoption of laws guaranteeing the rights of persons with disabilities worldwide, and in the expansion of accessible environments that can be enjoyed by persons with disabilities on an equal basis with others. But despite this progress, persons with disabilities are being left behind in all 17 Sustainable Development Goals. Gaps between persons with and without disabilities reach 20 percentage points for poverty and employment. Among the 63 SDG targets that we analyzed in the Disability and Development Report 2024, only 6% are on track. For 30%, the progress is insufficient, and for 14%, the situation has stalled or deteriorated. Progress needs to be accelerated between 2 to 65 times faster to meet these targets by 2030. This lack of progress can have a drastic impact in the lives of persons with disabilities. At the current rates of progress, persons with disabilities will face barriers to evacuate when a sudden disaster hits till the year 2218. Monitoring the implementation of the convention is key to guide policy making to address these challenges. The availability of disability data is at a high point, and that is good news. The Disability and Development Report 2024 analyzed 40% more data points than the ones we had in 2018. However, much needs to be done still to fill the remaining data gaps. So for half of the 63 targets that we analyzed in the report last year, we have no idea what's happening because there is no data to assess progress. So this slide event touches on two approaches that can be groundbreaking for monitoring the convention: community engagement and artificial intelligence. First, on community engagement. Until a few years ago, it was impossible to provide an assessment of the accessibility of physical places worldwide. Now, data provided by people around the world through their smartphones tell us whether the schools, supermarkets, pharmacies, government ministries, museums, and dozens of other premises that they use are or not accessible for wheelchair users. So in the report last year, we used 1.7 million of these data points to provide a global assessment of the wheelchair accessibility of physical places worldwide. This approach can be expanded to fill other data gaps. Second, on artificial intelligence. Thanks to the adoption of the convention in 2006, we now have reports covering data and national policies produced by 193 state parties and shadow organizations every 4 years. Yet, because these reports are available in text formats, they are impossible to analyze in an efficient manner using traditional resources. We also have now a multitude of disability data sets across countries, international organizations, research institutes, NGOs, and others. Putting all these data sets together remains a challenge. Artificial intelligence can provide the tools to bring all of this information together. However, these new approaches also carry some risks if they are not designed with persons with disabilities in mind. We need to ensure that the collection and evidence obtained through community engagement and artificial intelligence, including any smartphone and websites, is designed to be accessible and inclusive of persons with disabilities. We also need to engage persons with disabilities and their representative organizations in this work that can offer their direct perspectives. And we need to build capacity in countries with fewer resources so that they can participate in these innovations. UNDESA is continuously making efforts to promote awareness on the urgency of the implementation of the convention and the 2030 agenda by, for, and with persons with disabilities. Many governments and other stakeholders have joined us in these efforts. I am confident that today's event will be an important step in advancing the monitoring and implementation of the convention. I thank you.
Thank you so much. I think we're still waiting. Okay, so we'll move on and you'll let me know when it's time. Thank you.
Thank you.
It's my pleasure, my pleasure. So I would like to start now with some of our themes that are talking about different types of data and the use of these technologies and tools. And I will start first as I talk about the use of AI text mining for community-driven CRPD monitoring and evaluation. So I'm really excited to say that this paper is a collaboration of multiple colleagues. Dr. Keiko Shikako, who's online, Theodore O. Chang, Juliana Woods, and Mina Aydin. This is a paper that has been accepted by the journal Data and Policy. And I put a little QR code on the screen here if you'd like to get the full paper when it comes out, you'll be able to go to the Data and Policy website and get the full paper. And I'm really excited about this work that we're doing together. So the problem that we're trying to address is the one that Ambassador Gallegos alluded to, and that Dr. Martino talked about as well, is we have over 500 multilateral treaties. Each of these treaties requires monitoring and evaluation, and particularly for the communities that are affected by these communities, by these treaties. That poses a tremendous challenge for the communities, the states, and the organizations that are interested in the implementation of these particular treaties. A treaty also requires the state party to respond, to prepare material, written material, testifying to how much progress that state is making in this area. And so those state party reports become a wealth of data for us to be able to analyze. In addition to the committee responses, all of the text-based data related to the state party reports. And this is the same, of course, in the CRPD. The CRPD has state party reports. Those reports are presented to the expert committee on the rights of persons with disabilities. The committee responds. We also have shadow reports. So all of this text-based data becomes a very useful tool for us to monitor CRPD implementation. The challenge with these state reports, just like many other forms of text-based data, is that it's very difficult and challenging for everybody to read through all of these text-based resources. And so there are tools for us to use to be able to analyze large-scale text-based data. So we have 3 questions, research questions in the paper that let us focus on how do we analyze this kind of text-based data. And it uses text analytics and natural language processing that lets us do pretty amazing things analyzing this text. But then we asked a 4th question that says, could we take that same approach with natural language processing and use the new generative AI tools to do the same thing? Because if we take the NLP-based approach, that requires you to do programming in R and Python to do the natural language processing, to be comfortable working in an integrated development environment. But if you are, you can achieve some pretty amazing things analyzing text. But if you can't, you don't get to take advantage of those tools. And that's why the analytical techniques that we're using for the generative AI tools to compare what we can do with traditional natural language processing is pretty amazing. So I just want to show you a quick example of what you can do with traditional natural language processing on very, very large volumes of data on a big corpus. So we can get things like most frequently occurring words, so keywords, key phrases. We can look at things called topics, so we can do topic modeling. We can identify coherent topics within a data set and the words and phrases that are linked to those topics. We can also identify named entities. So we can say what types of entities, whether they be persons, places, organizations, dates, currency, we can identify that in the data set. And we can also identify specific organizations, people within the data sets. We also take another approach, which is called building a lexicon or a dictionary. And you can use a dictionary to assess the extent to which those concepts that the dictionary measures are in the data set or not. So we built a lexicon on all 50 articles of the CRPD and all the paragraphs in the CRPD. So we can then tell what are the most, within these state party reports, what are the areas that are being focused on the most by the states that are reporting on their progress. So we can identify, for example, Article 8 is the CRPD article that is getting the most attention in all of the state party reports, followed by Article 23, Article 9. We can also go down to the paragraph level, so we can see what paragraphs are receiving the most attention. We can also see which areas of the CRPD are receiving the least attention in the state reports. So Article 49, Article 42, Article 41, and 40 are receiving the least attention in all of the state party reports. We can also do things like comparing across any variable that we have in the data set. So we can compare across region, we can compare over time. So there are all kinds of things we can do. So for example, here we're looking at comparing Africa, the Americas, Asia, and Europe in terms of what those state party reports are focusing on. And we can also say where they're not focusing in those regions as well. We can also compare states that have ratified the optional protocol versus those states that haven't ratified the optional protocol and see if there are any differences in their reports. And then we also created a second dictionary to measure the language in the rights-based approach versus the medical model approach, and to see, this is heartening, I think, to all of us that care about the CRPD, to see that the language representing the social justice and rights-based model is dominating the state party reports, but it's not 100%. So there's still medical model language in a lot of the state party reports. So given those are the kinds of things we can do with NLP-based approaches, there's a question that says, well, can we get the same types of answers when we are using generative AI tools? And so we use, these are four of my favorite tools that I use in my toolbox. So ChatGPT, Claude, Notebook LM, and Google's AI Studio. Each of those I'd be happy to talk more about. There are reasons for using those. And we think that this is the approach that will make it very easy for community-based organizations to be able to get some of the same value out of analyzing text when they don't have to do the programming. So I'm just going to run you through quickly the methodology for each one of these. So if you take a platform like ChatGPT, the same kind of CSV file that we're using for the natural language processing can be uploaded into ChatGPT. You can then start to query it with prompts to let it summarize the data. So it'll summarize the data set. And you can start to ask the same kinds of questions about keyword frequency, phrase frequency, topic modeling. You can compare across regions. You can have it do named entity recognition. It's very amazing. And similarly with Claude. Claude happens to be my favorite of these platforms because Claude will also show you the programming that you need to do, that it's going to do behind the scenes to find the answers. So if you want to use that code, you can, or if you want to tell it to do the code, you can. So here you see Claude giving the examples in JavaScript, but if you told it to do it in Python or R, it would do it for you as well. Claude also takes the extra steps of automatically doing visualization. So you can show it shows you the visualizations as well. Notebook LM is another amazing generative AI tool. This is called a RAG hi Chelsea, a RAG AI application. RAG stands for Retrieval Augmented Generation. So here we can load 50 documents, 50 PDFs, for example. So we did a stratified sample of the state reports and loaded 49 state reports into Notebook LM, and you can have it generate an audio podcast interview in multiple languages. You can interrupt it. You can have it generate things like study guides, timelines. You can do a mind map, and you can still prompt it with the same kind of prompts you can prompt, say, ChatGPT with. So it's phenomenal. The other tool is Google's AI Studio. So Google's AI Studio is similar in some ways, but it does let you change the models that you have access to and so forth. So if you go back to Claude and ChatGPT, both of those as platforms give you access to multiple large language models, and you can begin to choose which one works best for you. So we wanted to make this a little bit easier, and Sophie and I have been talking a lot. So we decided to simplify this process in some ways. And so we built a prototype dashboard in Python to be able to make some data sets available to the user and allow the user to upload additional data sets and to allow the user to upload individual PDF documents. So we'll be talking about that a little bit later. So I'm excited that this morning I could share some of these results with you, and I look forward to chatting with everyone a little later. So would you like us to go back now, or, okay, great. So Sophie, if you don't mind, we'll go back. So we now have our interpreter here. Thank you. So happy to have you. And we're going to go to our opening address from
Eu vou falar aqui em português.
Okay.
Eu falo em
So-
português, tu fala aqui.
All right, so we have Ana Paula Feminella, the National Secretary of the Rights of Persons with Disabilities from the Brazilian Ministry of Human Rights and Citizenship in the Federative Republic of Brazil.
Muito obrigada, é uma grande satisfação, uma honra estar aqui com vocês. Muito obrigada pela compreensão. Aqui estamos com a nossa tradutora, intérprete. É uma grande satisfação representar o Brasil nesse importante evento. Aqui presente, né, quero saudar o embaixador Galegos e todos os pesquisadores, ativistas, né, em torno da implementação da Convenção Internacional sobre os Direitos da Pessoa com Deficiência.
Good morning. It's great to be here. I have my interpreter now with me, and it's a great pleasure to be representing the Brazilian government in this event that brings together leaderships, researchers, and civil society representatives from different countries committed to the implementation of the Convention of the Rights of People with Disabilities.
Eu cumprimento o senhor Derek Coiburn pela organização cuidadosa dessa atividade e a todas as pessoas, né? Ela nos dá essa orientação, a Convenção Internacional sobre os Direitos da Pessoa com Deficiência nos dá esse marco legal e também esse marco político e ético em torno dos direitos da pessoa com deficiência, né? Para que a gente participe da vida social, econômica, cultural e política, né? E para isso o monitoramento da implementação da CRPD é fundamental e precisa ser contínuo pelos Estados-partes.
So I'd like to greet the president of Professor Derek Cockburn for the careful organization of this side event. And as we know, the CRPD offers us more than a legal framework. It gives us guidance at the ethical and political level, and it's a call for us to build inclusive societies in which people with disabilities can have full participation in social, economic, cultural, and political life. And therefore, the monitoring and implementation of this convention, it is not just a commitment, but it should also be continuous by the state parties.
No Brasil, temos esse compromisso com a implementação da Convenção através de diversas políticas públicas e temos também a Lei Brasileira de Inclusão, que está completando 10 anos, e avança para dar operacionalidade aos direitos, né, na perspectiva das diretrizes da CRPD. Mas também a gente tem muitos limites, temos consciência dos desafios, né, que permanecem, né, especialmente no que se refere à efetividade da equidade e que ainda permanece bastante invisível a agenda de deficiência pela perspectiva dos direitos humanos.
So in Brazil, this commitment is translated in several public policies. We have an inclusion law in Brazil that is robust and that it reaffirms the principles of CRPD and advances regulation of fundamental rights. It is more recently the new plan to live without limits. But at the same time, we are aware of the challenges that we face, especially in what regards the effectiveness and the equity of the assurance of these rights within this framework.
Por isso, esse side event, a pesquisa apresentada aqui pelo Sr. Derek, são fundamentais para a gente perceber como monitorar os direitos da pessoa com deficiência, que dados utilizarmos e quais vozes são ouvidas, né? E como né, a inclusão ainda requer dados qualitativos e práticas baseadas no território como parte das estratégias de monitoramento.
Therefore, these initiatives on this side, that's why the initiatives in this side event are so important, because they do open a space for us to reflect about how we could monitor the rights of people with disabilities, which data we use, what voices are heard, and what are the ones that remain invisible and unheard. I would like to highlight an aspect that I consider to be essential, which is the inclusion of qualitative data in the practices based on territory as part of the monitoring strategies.
As abordagens tradicionais, muitas vezes centradas em estatísticas dos países, não são suficientes, né? Não dão conta sozinhas da complexidade das realidades locais. E isso é particularmente evidente nos países com grandes desigualdades regionais, como o Brasil, né? Nossos dados oficiais sobre o acesso a direitos, por exemplo, refletem majoritariamente as experiências de quem consegue chegar aos serviços públicos, o que já exclui uma grande parte da nossa população.
So the traditional ways to deal with all of this are often focused on national statistics, and they are important, but they by themselves do not deal with the complexity of the local realities. This is particularly evident in countries with great inequalities, regional inequalities, such as Brazil. Our data official data shows that the access to rights, for instance, reflect in its majority the experiences of the ones who can reach these services, which by itself already excludes a significant part of the population.
Quero ainda destacar que o governo brasileiro tem investido no fortalecimento de políticas intersetoriais e na ampliação do acesso à tecnologia assistiva como parte fundamental da inclusão. O novo plano Viver Sem Limite, por exemplo, traz um eixo dedicado exclusivamente às tecnologias assistivas, reconhecendo que nenhuma política de inclusão se sustenta sem considerar as tecnologias que mediam o acesso à autonomia.
And I would like to also highlight that the Brazilian government has invested in the strengthening of intersectorial policies and the expansion of access to assistive technology as an essential part of inclusion. Our plan, Live Without Limits, for instance, brings a very focused access exclusively on this assistive technology, recognizing that no inclusion policy can survive without taking into account the technologies that intermediate the access to autonomy.
Finalizo reforçando nosso compromisso com os princípios da CRPD e com os Objetivos de Desenvolvimento Sustentável, especialmente de não deixar ninguém para trás. E isso exige não apenas ações institucionais, mas também a escuta, o diálogo e a articulação com as comunidades.
And I would like to conclude reiterating our commitment to the CRPD principles and with the targets and goals of sustainable development, the Sustainable Development Goals, especially the one of not leaving anyone behind. This demands not only actions from the institutions, but also active listening, dialogue, and the articulation with the communities.
Desejo um excelente evento, que saímos daqui com novas ideias e colaborações concretas para fortalecer o direito à participação social das pessoas com deficiência em todo o mundo. Muito obrigada.
I wish you all an excellent event, and I wish that we can get at the end new ideas and concrete collaboration so that we can strengthen the right to participation of people with disabilities world over. Thank you very much.
Thank you so much, Madam Secretary. Appreciate that. Wonderful remarks, and thank you to our interpreter as well. Wow, that was pretty moving. So now let's move to our partner in crime, Dr. Sophie Mitra, to talk about the Disability Data Initiative and some of the work that she's doing at Fordham University.
Great. Thank you so much, Derek, for organizing. So I'm going to present the work of a large team that is the Disability Data Initiative, and that recently launched 2 databases. So the mission, first of all, some background, the mission of the Disability Data Initiative is to provide analysis of disability data to help advance human rights and sustainable development for all. Next. So we are a large team based in different parts of the world. So I'm based in New York. We have a team in Sub-Saharan Africa, in South Africa, a team in Colombia, another one in Switzerland, and another one in India. And we are a multidisciplinary team. So we have backgrounds in economics, statistics, data analysis, but also public health and sociology. More? Yeah. So you have here the websites that I will be referring to. So it's disabilitydatainitiative.org. And the website for the databases that I will be presenting is ds-e.disabilitydatainitiative.org. Okay, so the first database is called the Disability Statistics Questionnaire Review Database, so DSQR in short. So the database was created to document if population and housing censuses, as well as household surveys, collect disability data in an internationally comparable way. So why is that important for us to do that? Well, we need data, as was mentioned before. We need to make the situation of persons with disabilities visible. That's important. That's inherently important, but it's also important for the 2030 agenda and the goal of leaving no one behind. But it's also important as part of Article 31 of the CRPD that mandates that states need to collect data to monitor the implementation of the CRPD. So what we do is that we track whether the questionnaires of household surveys or population censuses include either the Washington Group short set of questions. So these are 6 questions that ask about difficulty seeing, walking, hearing, and so on, that have been tested and shown to be internationally comparable. Or similar questions. So similar questions are questions that at least meet the United Nations guidelines on disability measurement for population censuses. So we need to find at least 4 questions that are asking about seeing, hearing, cognition, and walking difficulties. So we've been doing this work of reviewing questionnaires since 2021. We've reviewed so far questionnaires of more than 3,000 censuses and surveys for 199 countries between 2009 and 2023. And I'm going to show you in the next slide some of the interactive platform where the information is available, as well as some of the findings from the analysis. So here, this is the homepage for the database. So it has a world map. So on the world map is color-coded to show if we have reviewed and found questionnaires that include the Washington Group short set, in green, or similar questions that meet the UN guideline for censuses in blue, or we have not found any such questions. So if we have not found any such questions, well, perhaps we miss some important data sets, that's possible, but it could be that the internationally comparable questions have not been used, and other questions that perhaps work at the national level but are not going to work to do cross-country comparisons are not in the data sets we reviewed. So next. So in the platform, you can go into details. So you can pick particular countries. So here on the screen, you see if I pick Haiti in the Caribbean, you can have a list of the data sets we reviewed and what we found. So here, for instance, we have found in the Demographic and Health Survey of 2016-2017, we found the Washington Group short set. So we hope that this work of reviewing and showcasing data sets and their disability questions will facilitate the work of researchers in terms of identifying data sets that have the questions they might need, but also is a way to track the implementation of Article 31. So overall, we looked at patterns in terms of the availability of data. So using short questionnaires such as the Washington Group short set. And we find that since 2009, the Washington Group short set is increasingly available worldwide, as shown in this graph here. And in particular, I mean, in population censuses. So here you see that in the 2020 round of censuses, the Washington Group short set was included in many countries. Next. The next database is the Disability Statistics Estimates database. So here we pick some of the population censuses or household surveys where we identified internationally comparable questions and we analyze them. We produce, so far, I'm going to show results for 40 countries. That's what we have included in the database so far. And 40 countries, 29 indicators. So it's a novel database grounded in human rights framework. Next. So here you have the homepage of the interactive platform. So you can download the entire database, but you can also use the interactive platform if you need particular results. So here you see the homepage. On the left side, you have a menu, so you can choose the language, the countries of interest. Among the 40 countries we have results for so far, you pick your indicator, and you can also pick specific groups. So if you're interested in older adults, you can focus on older adults. If you're interested in women, you can pick women, and so on. So here, for instance, on this graph, you can see results for 3 countries in sub-Saharan Africa for using a disability versus no disability comparison. But if you were interested in perhaps persons with more severe disabilities or persons with a particular disability type, like walking difficulty, you could get the same indicators for these subgroups. Next. So in addition to providing information at the national level, we also provide subnational estimates. So, for instance, here I have, if I'm interested in Guatemala and I pick Guatemala, I continue to be interested in poverty. So here I have a graph representing the map of Guatemala with poverty rates for persons with disabilities at the first subnational level. Now, this information shows in many countries, we see a lot of variation from area to area at the subnational level. So that could also help monitor the CRPD within a country across regions. Now, this information is available in a map format, but also in a table format at the first and second subnational level. So second subnational level in most countries is called the district. Next. So if you want more information, you have our email contact here, disabilitydatainitiative.help@gmail.com. And in the next slide, you have references to 2 papers where we describe the 2 databases in some detail. And we plan to update the database and enhance it with more countries, more results on a regular basis with the next edition, hopefully this December. Thank you very much.
Thank you so much, Dr. Mitra. That is just wonderful, wonderful work. Let's now turn to theme 3, another data type, accessibility mapping applications and local data awareness. Jason Da Silva.
Next slide. So this presentation is dedicated to my son, Jason Da Silva. Inspire every day. Next slide.
Hi everyone, my name is Melissa Day. I work with Jason on Access Map. We just wanted to start off with just giving a general idea of the statistics of people who are living with disabilities in the United States and globally. So right now, and this is information per the CDC and World Health Organization websites, we're looking at about 28.7% of the US population currently living with a disability. That is totaling over 70 million people. And then out of that, we're looking at about 40 million people who in the world who would be considered to be living with a severe disability. When we looked at those numbers globally, we're seeing about 16% of the global population reported to be living with a disability, and that is totaling over 1.3 billion people. So, accessibility is, at the end of the day, global, and it is a global issue. So, we are here at the UN Convention of the Rights of Persons with Disabilities Convention because they do recognize accessibility as a basic human right. Article 9 does obligate governments to ensure equal access to public spaces, transportation, and information. Access Map helps bring this to life by enabling people with disabilities to assess and advocate for accessible spaces in their own communities. Access Map is a global resource for adding, finding, and sharing accessible places. Essentially, this is an application that you can download on any Android or iOS device. In addition to using our web version, there's also some QR codes if anyone is interested in downloading the application. We would highly encourage you to do so. What the platform is essentially is a way for users to find accessible locations. Let's say that you are a person who needs a wheelchair, let's say for an example, to get around. It can be really detrimental to not be aware that there's a step or two getting into a location. So this application allows us to gather that kind of data surrounding every single location. So we're gathering external factors, internal factors, and information regarding the bathroom so that everyone's able to look up a place and assess whether that is a location that they're able to visit or participate in. So yeah, the goal is to find accessible locations, quickly scan a venue, complete a review in a matter of moments, and then submit a review that other users are going to be able to reference at a later point. Currently, we are experiencing, we have tremendous traction, and we did actually update this slide. So after looking into the numbers since 2010, we've actually experienced 430% organic growth. So we're just really continuing on that path. We also, so as you can see, we have around 15,000 users, 124,000 reviews. We were actually able to historically look at our Mapathon data. We actually have over 440 recorded Mapathons in Access Map, and we have mapped over 200 cities globally. Some of our key partners are listed here, including the Bertha Foundation, the MacArthur Foundation, the New York Community of Trust, the New York Times, the Rubin Foundation, Google, and the United Nations. So we also wanted to talk about some of our goals with Access Map. So one of the first things that we are launching is our generative AI comment section. Currently, at the end of a review, you have the option to write a comment to let other users know any specific details that you think might be relevant to someone else accessing that location. However, if you're unable to do that, or if you simply don't have time, we have a generate comment section now where you're actually able to generate a comment based on the answers that you've previously provided in the review. So it will autofill based on the information that you've provided and give a little paragraph just so that maybe if someone doesn't want to look at all of the answers, they can at least just see a quick overview of the application. And we'll go next. AI robotics. So robotics is our next really big goal for Access Map. It'll essentially allow us to gather data, take out the potential for human error that does come with the crowdsourced data model. And this option will be able to complete more reviews and include a lot more inclusivity data around the world. So our goal would be to deploy AI robotic platforms to autonomously collect standardized data surrounding accessibility of locations. So the other great thing about being AI is it's going to answer all of the questions, in a very black and white manner. It's going to answer everything very similarly. So all of the reviews that we do receive from those AI robots would actually just be very consistent, which is really great for end users. They're also going to be equipped with LiDAR, depth sensors, IMUs, and vision-based AI so that they can measure the specific features and questions that we do ask them. Our impact, so when we initially launched this pilot project, we are hoping to have an 80% increase in accessibility coverage in our pilot zone, which would be New York City initially, over a period of 12 months. Obviously getting that objective standardized data that we were just talking about and reducing the human labor aspect of it will be great so that no one has to physically go there to find out that it's not accessible for the information to be available to the end user. Our initial pilot goals are going to be to deploy 1 to 3 robots in New York City. Once we capture 5,000 or more data points in 6 months, we will kind of assess the program, see where we want to go from there, what cities are we looking into expanding into next, publish our finding, and hopefully be able to launch and replicate the program overall. So yeah, this is the QR codes again. If you are interested in downloading, please feel free to do so. You can also find it at AXS Map on any on Android or iOS in your Apple App Store or accessmap.com.
Thank you so much, Jason and Melissa. Really excited to have you here. I am going to switch over to our colleague, Keiko Shikako, who's not with us here. Keiko, I'm going to stop sharing and let's see if you can share.
I think, am I sharing? I think I am.
Doesn't look like it. I'm not seeing it yet.
You're not? Oh.
No.
It says on my monitor that I am sharing. Maybe someone in the audience can, or on the Zoom can say if
I can see it.
Okay, so it's not coming up here. Oh, wait a minute, there it is.
it is. You found it?
a little button that I didn't see.
Okay, sounds
Okay,
good.
you're good to go now. We see it.
Good, thank you. Thank you, everyone. It's a pleasure. It's really too bad that I'm not here. I'm not there with you this year, but it's a pleasure to be here virtually and to join many of you. Thank you, Derek, for organizing, and thank you, everyone, for your contributions. So I will try to cover really fast some aspects related to monitoring or community-based monitoring and some research that we've been doing on related to the rights of children with disabilities. So moving from the data that is for everyone and thinking of accessibility, fantastic presentations to some projects that are specific for children and how we are dealing with trying to identify ways to support communities, support families and children and youth in the realization of their rights. So we all have rights. We don't need to to explain that here. But when thinking of human rights, children with disabilities are often a group that is left behind for in many initiatives, many reports that have already shown that not only children, but other populations, of course, that face intersectionality within the rights. So that's where this work is looking at. In the world, around the world, we have an average like from 6 to 15% of children who have a disabilities. So this is a population that is a large consideration for the disability rights monitoring thinking. However, many reports, including those from the previous special rapporteur, has identified that there is a legacy of a model that continues to cause exclusion for children, and we can no longer let this happen. So that's the work we're trying to address. Particularly in Canada, where I'm currently in, we know that Canada scores low for child and youth health and well-being among the wealthy countries. And we also know from 2 sets of concluding observations to the CRPD reporting now that there are very, very few indicators for children specifically. There's a lot of data that is missing, and there's this gap between disability rights are somehow and in different ways being monitored. Children rights are somehow being monitored, but the rights of children with disabilities in this intersection, there are several gaps there that we need to address. Importantly, for play, for children, as we know, play is the main occupation, the main job that children should be doing. And to know that in many places, children cannot play, or someone is telling them either by having built barriers in the environment or by attitudes or by lack of programs and supports, children are not being able to play when play is a fundamental right for children. This right is both secured by the Convention on the Rights of Persons with Disabilities and on the Convention on the Rights of the Child. So although we have double protections, we have lots of gaps there. Thinking of the CRC and the CRPD intersection, there is an Article 23 on the CRC is for children with disabilities, and Article 7 on the CRPD. And those are the articles that we are trying to cover. We know, and this group is definitely there for this reason, if we don't measure it, we can monitor. If we don't monitor, we can change it. And that's why we are using several different methods. Some of them are AI and technology based. Some are based on participatory research approaches. We have several youth parents, youth council, parent council, and organizations, CSOs and OPDs that are involved in this work. We have developed with them and have used the CRC indicators, the CRPD indicators proposed by the OHCHR, and we also developed the CHILD-CHI, the Community Health Inclusion Index, that looks into ways that communities are accessible for children. And we've used text mining, the work with Professor Cockburn, and looking and reviewing policies and programs that was already presented at both national and subnational levels. And we also analyzing existing national data sets with Statistics Canada and others. And today I'll talk a little bit more about the use of the mobile app, Jouer, which is a mobile app similar to AXS Map, but that we look into programs that are inclusive for children with disabilities and specifically leisure programs. So the child framework is a framework that we merged a lot of those indicators. We did a consensus process to identify different aspects that can be holistically considered and measured as indicator for children with disabilities specifically. You can scan the QR code, hopefully it works, and we can talk more about it later. And through this framework and looking into indicators and existing data sets, we identified a few of the big issues for children. So access to inclusive services and spaces, and inclusive here for children, there's an added consideration. So for example, we know many cities have, across the globe, have the UNICEF child-friendly cities accreditation, but we developed here in Montreal and in Quebec in partnership with the government, an addition to this child-friendly cities that includes specifically children with disabilities and what you need to have a child with disability-friendly city. The experiences of stigma of children are not measured consistently and in many, many different data sets. The subjective experience of competence, the family's quality of life, how children with disability experience and are supported when they self-harm, including abuse, and also how their peer group integration. So those are some existing critical gaps. We also looking into the national data sets. We learned that children with disabilities, they know less about their rights when comparing to children without disabilities, and that's in Canada. And there are some indicators that we have absolutely no idea that those were prioritized by families and by different consensus process in this project. But we don't know, for example, how families are unpaid, how the extent to the unpaid time spent caring for their child, the income of families with a child with disability. We don't know. We don't have information on that. We don't know about child care payments associating with caring for a child with disability and other demographic gaps, like well-being of children in rural areas, out of the urban centers, and different race, ethnicity gaps, and income gaps for different groups of children with different types of complex disabilities, particularly. The coordination of services and lack of access is stagnant, and we know that from data looking into during the COVID pandemic, work with Professor Cockburn, we developed this model looking into the different articles of the CRPD, and we looked into policies, different populations, different countries, different groups, and you can see some of those references here, and we can discuss later, but we do know that there are many, many aspects related to Article 24 in education that we have very little information on about living independent and in community, and in general, information about children lacking on the policies that we analyzed. The Jouer app then tried to tackle one of these aspects, that is community participation and the availability of programs, inclusive adaptive programs in the community. So GPS-based, but looking into arts, camp, sports, and other programs such as respite care, playgrounds, public play areas, and other. That children can choose activities that are close to where they are, that align with their preferences and disabilities, and also they can connect to others. So both families, service providers, and youth can connect to each other. And we have now it's over already, 5,000 users across Canada, some in Australia. This is a map. Too many QR codes for the day, but if you want to know more information about Jouer and find activities in Canada, we have, through this work and mapping and largely crowdsourced data, but we were able to look into how we can support and foster inclusion in those community programs, how we can identify patterns related to social and material deprivation in the geographical areas and the provision of leisure services. We could engage with community organizations to create value, and we had a series of policy and citizen dialogues in different places around inclusivity and leisure. And we could map inequities in service provision across different regions with different partners. So we need comprehensive indicators. We need to have those numbers and to have this data collected in order to inform policy and program development that considers all this intersectionality. When looking into this data, and I'm very curious to engage in the discussion, we should be able to see how different equity deserving groups within disability groups are being attended or ignored in many cases. So some of those groups to consider. And we also need to facilitate access for a community to use this data analyze this data in relation to the CRPD and extract this data to use into research policy and advocacy efforts. Thank you very much. This work is supported by many funding and many nice people, and it's a pleasure to be here. I'll be glad to join discussion. Thank you.
Thank you very much, Dr. Shikako. We appreciate that. And last but not least, our fifth theme is on digital fabrication and generative design for assistive technology. Professor Carolina Maria de Carmo Alonso.
I have to turn on my mic.
Yeah, it's.
Okay. Hey, good morning. It's a pleasure to join you today. And first, I'd like to thank Professor Coburn for organizing this event. I also want to acknowledge the presence of Brazilian National Secretary of Rights of Persons with Disability for supporting this event, and of course, all other authorities and colleagues here today.
I'd like to give them a round of applause, so thank you.
Well, today I'd like to share some thoughts on the challenge of identifying visible needs in the field of assistive technology, particularly in the context of a global south, with Brazil as an example. Please, the next slide, please. I've structured my presentation into 3 parts: the rights to assistive technology in Brazil, challenges to fulfill of these rights, and some pathways to overcome these challenges. So the next, please. So why talk about assistive technology? Because it's a fundamental for realizing other rights such as education, work, mobility, health, and communication. It allows persons with disability to live independently, participate in school, employment, communicate, and navigate both physical and digital environment. Next, please, next slide. Have established this importance, let's now look at the legal framework that supports these rights in Brazil. Brazil is signatory to the CRPD, which holds a constitutional status in our country. The CRPD was integrated into national legislation through the Brazilian law of the inclusion of persons with disability in 2015, as Ana Paula told us 10 years ago. This law, next one, please. This law explicitly mentioned assistive technology 26 times, including sections related to health, education, work, accessibility, and justice. And more recently, the new Living Without Limit plan includes an entire axis dedicated to assistive technology. So from a legal standpoint, we are in a strong position, but rights in law do not always translate into rights in practice. So we must look for our challenges. Please, the next one. The next one, please. Okay. First challenge. Brazil is a continental country marked by profound inequality. São Paulo, the city of São Paulo, for example, has advanced public health and rehabilitation services, including renowned centers like the Lucy Montoro Network. But at the same time, many people across the country cannot access even the most basic rehabilitation services, and consequently, they can't access assistive devices. In rural areas, riverside communities, and low-income neighborhoods, also known as favela in Brazil, public services are limited. Both policymakers and researchers often rely on data from large urban centers for people who reach the system, overlooking the relatives of those who are hardly reached by the system. So we cannot respond to what we cannot see.
the second, please. The second challenge we face in Brazil, just a disclaimer, in Brazil, assistive technology is provided not only by health, but my focus in this presentation itself. So our public system has a central role in providing assistive technology. It is the largest public health system in the world in terms of coverage, and it's universal, providing free healthcare to the entire Brazilian population. However, regarding assistive technology, our healthcare system faces serious limitations. The current model for providing assistive technology is centralized and diagnosis-based. It relies on a defined list of devices, mostly prosthetics, orthotics, some hearing aids and mobility aids. We've had some progress with devices for visual impairments, but many essential technology is those that promote the independence in daily living, communication, environment control, and support for people with cognitive or intellectual disabilities are not important. So this model doesn't consider individual contextualized needs. It's rigid, fragmented, and unable to respond to the diversity of people's lives, especially in remote or underserved areas, as I've already mentioned. The system often focuses on what's available in procurement list and not necessarily what people actually need to participate fully in society. So to address this gap, next one, please. Just a sentence to give, but the next one, I'm worried about time. To address this gap, we must move beyond institutional frameworks and invest in territory-based data strategies, ones that help us understand people's real everyday needs for assistive technology, particularly in places where formal systems fail to capture the complexity of people's lives. One promised direction is to explore the role of the community health workers. These professionals are part of the family health strategy, a key component of Brazil's primary care system. And they are assigned to a specific territory. They must live where they work. And they know each one who lives in the specific territory. They visit rural households regularly and maintain close relationships with the families they serve. Moreover, the family health strategy is the most widespread health service in Brazil, reaching even the most remote or underserved areas. Rather than relying solely on traditional research methods or national level surveys, which often exclude the poorest and the most remote population, we could begin to generate data from within the communities themselves. Data rooted in their everyday life. Data that reveals not only what is missing, but what is possible. This is especially relevant for populations that have been structurally misrepresented. People with disabilities living in a situation of extreme vulnerability, where the intersection of poverty, geographic isolation leads to a profound invisibility. The next one. Wow. I think the last one, please. So, in conclusion, I propose that we discuss how we define and measure as, not the previous, please, I'm sorry. In conclusion, I propose that we discuss how we define and measure access to assistive technology. This requires a shift from centralized technocratic system to decentralized community informal groups, for standard indicators to context-sensitive listening, and from a focus on equipment provision to a broader understanding of what real inclusion means in daily life. Bringing together technical knowledge and the deep territorial insight of community health workers might be one of the most powerful strategies We have to reach those who are currently unseen in my country and to ensure that their needs and rights are no longer left out of the conversation. Thank you. And my email, the last one, please, there.
Thank you very much. That is very much in line with what we wanted to do with closing is how do we continue this conversation? We don't have time for the audience interaction that we wanted to have, but Ambassador Gallegos will offer some closing comments and we will wrap up.
Thank you. Thank you very much, sir. Thank you for our stellar panel for the presentations. I have, amongst my many experiences as a diplomat, I've been member of the Committee on the Convention Against Torture. So I have had the opportunity of monitoring state compliances and reports of state compliances. My principal observation in the process was the need for more engagement with civil society, because obviously governments, and having belonged to a government who reported to the treaty organs in Geneva, you have a system of reports, of course. But I think it is more important now, especially when you touch issues like disability, to have engagement by community, which I think is the underlining argument here amongst all of us in this panel. I have to congratulate the Secretary of Brazil for her leadership, and I think it is a demonstration of the capabilities that we have all a problem, and we must address this problem. Many of the examples you have given us are examples that permeate not only the global South, but the global North. Disability is an issue that unfortunately is suffering a regression in many of the cases politically, and we are very concerned about the adaptation of new theoretical issues. We were on a guideline of inclusion, and now we have a very serious problem. So this is a very timely panel because it addresses the issue from a scientific point of view and looks at the real practical measures to benefit those who have a disability and the communities and families that belong to this group. I would like to thank you all and acknowledge the effort and congratulate you on every one of the endeavors that are extremely important for what we've heard today, and wish you the best in working for this noble cause. Thank you very much.
Thank you, everyone. And thank you to our interpreters and captioners and everybody. Thank you. Have a good day.
Encantada.
Thank you, Keiko.
Thank you, Derek. Glad you wanna. Do you have to? You have to.
Yes, we have.
Out of the room fast. Okay, good. I'm disconnecting. We'll connect later. Thank you.
You too. Bye bye.